This has been a great area for me to live in and raise my family. We live in a calm, safe community environment with easy access to all the recreational and social activities that we want. And in addition, within a half-day's drive, we can be in New York City, Boston, Washington, Philadelphia, and enjoy all of the amenities of a big city without having to live with the hassles of being there full-time. This is, in a way, the quintessential small-town America. When I bought my first house, almost every day there was a pie on our porch. The neighbors dropped them off, welcoming us to the neighborhood. I like to do woodworking. The local lumber yard actually gives me a discount because I'm a physician, something you just don't see in most of America today. It's a place where physicians are respected and honored, actually. It's a quite humbling experience. I'm Joseph Scopelliti. I'm a gastroenterologist at the Guthrie Clinic. I've been a part of the GI department here for 27 years. When I arrived here on my very first day, I sensed that this was a different place. The facility was more than I expected, but it was really the people that impressed me. It's not a place where there's big clashing egos. It's really an area where the people believe in helping each other out professionally, clinically, personally, socially. And that has fostered a great many friendships and a wonderful place to be for work and for life. The camaraderie and collegiality of this organization comes from the attitudes and philosophies of the people that are here. Guthrie is a 100-year-old group practice, and it was organized for the purposes of meeting the patient's needs. The philosophical approach to patient care in a group practice is one of cooperation and collaboration around best possible outcomes for the patients. That's the subtle difference between our group practice philosophy and some of the newer business models that are developing. Guthrie is really a physician-led organization, starting from the very top. The Guthrie Clinic is governed by a board of 9 physician members. Those physicians are active practicing clinicians in the Guthrie Clinic, and they're elected by the physician members of the Guthrie Clinic. The success of this organization is based on 3 values that Dr. Guthrie gave us. They are patient-centeredness, teamwork, and excellence. Guthrie is a great place to be in our organization at any point in your career path because there are many choices. You can go from clinical care, primary responsibility, to education or research or administrative roles. We offer physicians a spectrum of choices that they can migrate to at any point in their career. We're looking for bright, energetic physicians who are interested in doing the very best job that they can for their patients. We really value physicians who have an understanding of that compassion that is necessary to provide great care, and we're looking for that individual to join our team. The single biggest advantage that I've found working at Guthrie as a gastroenterologist is a reduction of stress. If I have a patient with a cardiac problem, I have a colleague right down the hall who's there, willing and interested in helping me. And it was that reduction in stress that was so subtle, you didn't even notice it at first. It was only after a while being here that you realized how much easier it made your practice, and how much better it made your life, and how much it improved the patient's outcomes. I view that I have 2 goals. One is to look at the future and prepare the organization for whatever that future has to offer us. The second, and more important role, is to create a great work environment for our physician. Give them the resources, help them design the systems, and assist them in removing any obstacles so that they can produce the great care that they know how to do already and serve our patients' needs. 50 or 100 years from today, I would want people to look back at this period in the history of Guthrie and recognize that we adapted to the times, prepared for the future, and had an organizational design and function that was so flexible and so good that it didn't matter how healthcare changed, it was prepared.